The World Health Organization has expanded the definition of an airborne pathogen. It comes after controversy around the original definition led to miscommunication during the COVID-19 pandemic. A new report defines a new set of criteria for airborne infections. Most importantly, it found that a virus can still be defined as an airborne pathogen, regardless of the size of the droplet that spreads the illness. During the early days of the pandemic, scientists complained that the WHO failed to warn people of the risk that the virus could spread through the air. Scientists say the new definition is more precise and could help save lives in the future. Well, Dr. Amesh Adalja is a senior scholar at the Johns Hopkins Center for Health Security. He joins us live from Pittsburgh, Pennsylvania. Welcome to the programme. So how would this expanded definition have changed the world's response to the COVID-19 pandemic?
If we would have understood that small aerosol transmissions were occurring over short distances, that might have influenced what personal protective equipment were recommended for individuals to use. It also might have influenced people kind of falsely relying on a 6-foot distance to be kind of ironclad. So I think what it would have done has been more exact. But I think what this really does is try to bring the science up to date, because we were using some outdated ways of thinking about disease transmission that really wasn't fitting with aerobiology, even though it had a purpose and a role in hospital infection control.
And what about other viruses then? Should we be now changing our response to those too?
I do think that we've always known that, for example, influenza does transmit through the airborne route to some extent, and some through the droplet route. I think it's much more better to think about this in terms of what is the actual risk. So when you take a standard airborne disease like measles, it still has a very different epidemiology. It's much more contagious, for example, than COVID or influenza. So there's still gradations within it. But what I think it does is kind of keep us from being very rigid about what needs to be done for each type of virus, and really allows for the fact that improving air quality, improving, bringing in outdoor air, improving air exchanges makes sense for a whole host of respiratory viruses. And there may be a larger role for N95 masks, especially during certain medical procedures.
Where does this leave the public then in the event of any future pandemic? What should we all be doing? Because people would be forgiven for being very confused about all of this.
I think now people are very attuned to the benefit and value of N95 or N95 equivalent masks. So if there is another pandemic, and a pandemic is likely to be from a respiratory virus, the N95 mask is going to probably be the cornerstone and the first type of mask that's recommended, rather than homemade masks or even surgical masks, because these are now available in abundance and people are comfortable using them, and we know they offer the highest level of protection.
OK, we'll leave it there. Dr. Amesh Adalja, thank you very much indeed for joining us here on Al Jazeera.
Thanks for having me.